So a patient has asked me if he can correct his leg length difference at home. Yeah, so essentially the pelvis should be nice and straight. If it's being pulled upwards, it creates that difference in the pelvis, which then means if the leg starts high, ends high, it looks shorter. So what you want to do is relax the back muscle, which is pulling it up, so that's the QL, and you want to relax the pelvic muscles, so the glutes, piriformis and hip flexors, which pull it in. So for the QL, which is your back, any movement when you're bending forwards, stretching to the side, you'll feel it working through here. I have some low back stretches on my page, which shows a progression of sitting, standing. So essentially you want to lean forward, stretch diagonally. Then for your glutes, hip flexors and piriformis, relax those muscles. It's going to bring it back down again and stabilize it. Then focus on strength, so activate your glutes, have a strong low back to stop it from being asymmetrical in the future. Thank you. Into your pelvis. So if they're tight, they're going to pull it forwards and create more of a pressure. So we're laying down. The first one is for your piriformis, which is the outside of your hip. So you stabilize your hip that you're stretching. So I'm pushing this down just to stabilize. My left leg is straight. I'm going to grip my knee and stretch up and diagonally across, and I feel it through here. You want to make sure that you're stabilizing, otherwise if you let go, oh look how flexible I am. Whereas if you grip down, pull up and across, you'll feel that tension a lot better. So you hold it here, hold it for about 20 seconds. After 20 seconds you do a resistance. So the resistance is with my hand, I'm pulling back against my knee. So if my hand pulls this way, my knee is resisting that pressure to get the activation. Hold it for 10 seconds and then you relax the pressure on the leg. So you let the leg go floppy and then you pull a bit further over. So you'll find that it's a stretch, contract, stretch, contract. So stabilize, lift up, diagonally across, hold and breathe. Then resist back, so the knee is resisting the pressure with my hand, holding it here. Then we relax and you go further. Do the same on both sides. So we stabilize here, lift the leg up and across. And I feel that stretching on the outside of my leg. Holding it here. Breathing, resistance back, so push against the hand, hold it for 10. As it eases, you go further forwards. Do that 4 rounds in one go, all of these a couple of times through the day. The next is your glute stretch. So one leg bent, the other leg crosses over, and lets it hang out to the side. You're then going to grip your thigh. So if you can, you grip your thigh. If you're too tight, just bring your leg up as much as you can. You can do it this way, you'll still feel it stretching. But because I can, I'm going to grip my thigh. One hand lets go and just pushes down on your knee. So I'm pushing this way, downwards. And I'm going to feel that stretching in my glute through here. So you push down, you hold. To make it easier, you can just relax your foot against the wall. So imagining I'm just putting the foot against the wall. To make it harder, you bring the knee a little bit further forwards. So pushing down through here. Same thing, after 20 seconds, we have a resistance back. So this leg is going to push into my hand. So I'm pushing down, my leg contracts and I'm pushing. Notice that I don't let the hand move up too much. I just kind of meet where it is. You hold it for 10 and then the leg relaxes and you'll be able to stretch a bit further. Once 20 seconds has come, you resist the pressure, hold it for 10 and then relax and stretch further forwards. Again, 4 rounds, do both sides. How it looks on the other side. Cross it over, you pull this thigh up, then push downwards. So I feel like stretching on my left side. 20 seconds, then 10 seconds push up. Then relax. Hold and breathe. Push up again. Then relax. The last one laying down is for your hip. So one leg straight, your other leg bent out to the side. So stabilize the opposite hip, because if I was to push down, my whole body would stretch. So you want to keep that pressure here. In a figure 4 position, you just gently push down on your leg and you'll feel that here. You can do it better with a partner, so if you're laying on a bed, the partner could just gently push down, you'll feel it more in the groin, but you can still do it. So you push down, you feel it opening up through here. You then resist, so the pressure comes up, hold and push down. So again, I'm flexible, you may find you're up here. So you push down for 20 seconds, you have the resistance up, and then you relax and you go further. And you do that as a 3 or 4, kind of as much as you can through the day again. Okay, so another hip opener, which you can do sat down. So you're going to bring both feet in the middle and just gently lean forward Gently push down with your elbows onto your thighs. You're going to feel it stretching in here. If it's too much, you can do one at a time. Gently push down. If it's okay, lean forwards. Do the same on the other side. So just the leg comes like this. Push down, gently lean forwards, and you feel it stretching in here. You can lean back as well to get a gentle opening in your hip. But this one, come in the middle, lean forwards, gently push down. So again, you may find that you're up here, you gently push. You can do a breathing, so hold it as it eases, breathe out, lean forwards, push down a bit more. Same again, hold for about 10-20 seconds. As it eases, push down, and so on and so forth. The more you lean forwards, the harder it will be for your hips. So if you want to, you can just lean back and open it, and it's still opening your hip out through that.